We are starting our show for today with the Summit County Health Department's Dr. Phil Bondurant. He's going to update us on everything happening here in Summit County with COVID-19. Dr. Bondurant, thanks for being with us.
Good morning, Christine. Thank you for having me.
We've all heard that cases are up significantly here across our state of Utah. How are numbers here in Summit County?
Summit County is following a similar trend of the state. We're seeing an increase in the number of cases. I was just reviewing our data this morning, and we are in a transition or a period of growth for more than 3 days, as the data shows. And so we're seeing very similar to what the rest of the state is seeing, in that our number of cases are growing. There was a time where we were seeing 3 to 5 cases a day, and now we're upwards of seeing anywhere from 8 to 12 cases a day pop up here in Summit County, which is quite a few given our small population of only 42,000 people.
And are more individuals getting tested? Are those facilities that are testing people, are they seeing an increase in numbers?
Yeah, the hospitals reported that with the recent spike that the hospital up the street from us here has seen an increase in the number of people coming through for tests. We can see out our back window that the cars lined up there for the mobile testing site that they've set up. So while testing does obviously increase the number of positives that we see, it's not just a phenomenon. More testing equals more cases. It's the presence of the disease in our community, and more people are becoming infected as to what we were seeing just maybe a month and a half ago. So you look at the combination of the testing and everything else that we have going on, and there's definitely cases are on the increase here in Summit County.
Of course, a large concern as we see numbers increasing is our hospital capacity. How is the Park City Hospital doing right now as far as patients, ICU beds, and those kind of things that you have to be concerned about when you see a rise in numbers of COVID-19?
Yeah, so as far as I know, our hospital is doing very well. They obviously have concerns, similar concerns that we have and the rest of the state share. But one thing that's very important to remember about our Park City Hospital here is not only are the administrators doing an excellent job of preparing and being prepared for what's happening here in Summit County, but they share a network across Wasatch County, Summit County, and of course down into the valley. So while we may be somewhat limited here in our ICU beds, the capacity of IHC is much greater than just what we have here in Summit County. So while there's obviously a concern for the limited number of ICU beds here in the state, is one of the things we've been talking about from the very beginning. Park City is doing a great job in keeping these things under control and doing what they can to manage the situation and the number of beds they have both locally and as a collective system.
Now, would you define this increase in numbers as a second wave per se? I know that a month or so ago we were anticipating a second wave maybe in the fall or the winter, or does that really even matter?
I think it's too early to tell, but at this point it's probably a moot point. Obviously, we suspect there will be a surge sometime later in the fall, as has been predicted nationally and internationally. But right now, I believe that we're still trying to see stabilization in the numbers that we have as we've pulled back some restrictions and we've gone from orange to yellow and then modified the yellow phase in accordance with the governor. We're going to see the number of cases, and there's going to be a settling out of what we can expect to see on a daily basis. Now, with people being out more, there being more social events, people gathering, having barbecues and doing these things, we're going to see cases. So to say that this is a surge or a second surge is hard to say. It's hard to say if it's a stabilization phase. It's been across the state. It's gone up, it's gone down, it's leveled out, and now we're back surging again. So it's really difficult to say. I know Dr. Dunn at the State Department of Health has said that this is the escalation phase or the ramp-up phase, and so using the information that she has and some of the guidance that she's provided, it looks that way, but to say it's a second surge or what we've predicted to happen in the fall is really too early to make that prediction or assumption yet.
And the health department is likely under increased pressure to get information out. I'm curious, there's many things, of course, to be concerned about as these numbers increase, but what is top of the mind at the health department right now?
Right now, as you know, a couple weeks back, the health department and with the Summit County Council issued a joint public health order around masks and wearing masks in public and when indoors and social distancing is not available or allowed. You know, that's one of the things that we've heard a lot about over the course of the last week. Over the weekend, I was answering a number of emails from individuals both for and against the mask order. A lot of the information that we have available to us from academic resources still suggests that masks have the ability to reduce disease transmission. There are a lot of passionate people in the community that feel otherwise. But I still believe, and I know the council does as well as our health officer believes, that the mask mandate is a good effort to help reduce transmission here in Summit County. So that's really one of the things that we continue to look at, revise, refine, continue to review the literature that's available to us. A number of leading institutions and academic institutions still believe that masks are one of the important components. It's not the only component. It's not going to stop COVID all by itself, but it's one of the feathers in our cap that we can use to limit transmission, knowing that aerosolized droplets and aerosolized particles are the number one means of transmission. We would encourage people to continue to wear masks, to follow the mask mandate, and do what you can to protect your neighbor and protect those around you as we continue to work towards a solution and keep our fingers crossed that that vaccine is here sooner rather than later.
And in your opinion, do you think the community is following this mask mandate pretty well?
Generally speaking, I do. I think that people are compliant. They understand the value of it, understanding that it's a very difficult thing to enforce, but it's, there's been a number of different types of disciplines and sectors that have done studies on masks, and I read one from Goldman Sachs, the financial advisement and investment institution, which when you have the financial world digging into this and looking at the potential impact of masks, and Goldman Sachs comes out and says that a mask policy can nationwide could save the economy by 5% or improve the economy by 5%. Those are powerful statements made by people that have a lot on the line. And so generally speaking, I think our community realizes that. We've received a fair amount of support, and there's still concerns, and we're still working through those. The Board of Health is expected to have a public hearing about some of the appeals that we have received in regards to masks a week from today, July 20th, where they will hear appeals about masks and some of the exemptions within the mask ordinance. So we're continuing to work on that, refine it, make it better, understanding that we're doing the best we can given the resources we have, and there's still no instruction booklet on COVID and how to respond to COVID. And that being said, we're using what information and data we have to make the best educated decisions we can.
And has the directive changed on who should get testing? Do you still encourage anyone with any symptom to head to one of our free testing centers here in Summit County?
Absolutely. Anybody with any of the symptoms, anybody that's been in direct contact, which means close proximity for more than 15 minutes of a positive case or a confirmed case, should go and be tested. Really, that's going to be the crux of how we understand what's going on in Summit County and how we create strategies moving forward to manage and deal with this situation. So if you have any questions, concerns, or even an inkling that you might have been exposed or you're not feeling well, I highly encourage you to go be tested. And if you don't meet that criteria, the staff there at the testing center will be more than happy to work with you and help you understand exactly what's going on. But let them make that decision whether or not a test should be administered if you have that concern.
Excellent information here on this Monday. Dr. Phil Bondurant, thank you for joining us today. We very much appreciate all of your hard work and the entire staff at Summit County Health Department for working overtime constantly to help us through this pandemic.
Yes, thank you for having us, and we appreciate the continued support from both Park City TV as well as the community.
Again, thanks so much to Dr. Bondurant and the entire Summit County Health Department. We appreciate them taking the time to check in with us here at Park City Television on this Monday. We'll be back right after this. Stay with us.